I'm Vicki Liviakis. Welcome to Body Beautiful. It's the show where we talk with local professionals about the latest in cosmetic procedures. We also take your calls live on the air. With us today, we have plastic surgeon Dr. KRON Horton. We're going to be talking about breasts, breast enhancement, lifts, breast reduction, and a little later on, breast reconstruction. Later on, we'll be taking your calls with any questions you might have. The phone number, 800-440-4884. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And before we get started, of course, any advice we give you today, you're going to also want to consult your own physician for a second opinion. Welcome back to the show, Dr. Horton.
Thank you for having me. Welcome.
The topic, breasts, because what, today, this is breast...
It's National Breast Cancer Awareness Month, the whole month of October.
Okay. And breasts is something, obviously, examination, you know, in the spirit of the Awareness Month. Clients that come to you, most important thing, exams, right?
Yes. Prevention is key. I see a lot of women who either have just been diagnosed with breast cancer, which is very traumatic, and my goal is to help make their whole breast cancer treatment a positive one. So I do a lot of breast cancer reconstruction, both after breast cancer has been diagnosed, but we also do it prophylactically. Many women that either have a breast cancer gene or a very positive family history of breast cancer often seek to have a prophylactic mastectomy, meaning for prevention, and then breast cancer reconstruction as well.
So by prophylactic and prevention, meaning you just anticipate it, take the breast out before it becomes a problem?
Correct.
And then you do the reconstruction so that it looks basically the same.
The goal is to look as good as a woman does before, sometimes even better. So breast cancer reconstruction can be a positive.
Okay.
And you can get a bonus out of it as well.
You know, breasts are certainly very, in popular society. Yes, it's something that, we all pay a lot of attention to. Mm-hmm. You deal with breast enhancements as well. So let's just go down the list of some of the procedures, cosmetic procedures that are done to breasts these days.
Well, really, a breast can be lifted if a woman is happy in a bra, but if she's lost volume or if she has droop, but she's happy with the overall way that she fits into a bra, then a breast lift would be indicated. Some women have what we call symptomatic hypermastia, where the breasts are very, very large, they're very heavy, they're pendulous, and she can have symptoms related to very large and heavy breasts, and some women are seeking a breast reduction, which is often covered by insurance because there's some medical indications for that. And other women seek to have enhancement or to be a little bit larger or a little bit fuller, either similar to the way that they were before they had children, if they're moms, or similar to the way they were when they were breastfeeding.
And of course that is the most popular procedure.
It is.
A lot of younger women are having that done. And again, some tips about the timing in which to do that. Really, it's not so wise to do it while your body is still forming, I would imagine.
That's right. The FDA has recommended that breast augmentation be done after age 18, because most women have finished their breast development by age 18. There are two types of implants available, silicone and saline, and there's lots of different options for women. And really, the appropriate time to do a procedure is when it is for the woman herself. She needs to be doing it for herself, not for anyone else. She needs to be fully aware of the procedure, all of the risks, the benefits, the potential complications, what it means for her and her body, and she really has to do a lot of homework and to make a decision, is it right for her?
Now, last time you were here, you actually brought some samples of what it was like, what a saline breast implant is like and what a silicone one is like. And then there was another that was kind of like a jelly.
There's another one that's coming, and it's called the gummy bear implant. It also is a silicone gel implant, but it's a little bit more cohesive, meaning it's a little bit firmer. If you were to cut the implant, it would stay in two pieces, like a gummy bear, a head here and a tail here. And so that's attractive to some women that are maybe a little bit concerned about the more liquid silicone. However, all implants are safe. All implants have silicone. The shell is always made of silicone, and the fill is either saline or silicone.
Okay. So we're going to need to go to a break. I know you brought before and after pictures, and we do want to talk about breast reconstruction after mastectomy, but we're going to take this break, and for more information about Dr. Horton, you can certainly call 415-923-3067, or you can check her out on the web on womensplasticsurgery.com, and for the first 20 callers, you'll be able to receive a complimentary consultation. We'll be taking your phone calls and continue our chat about breasts when we come back on Body Beautiful. Welcome back to Body Beautiful. Right now we're talking with plastic surgeon Dr. KRON Horton about breast surgeries. We're going to be taking your calls. Any questions you have about breasts, the phone number to call, 800-440-4884. And we'll also be posting the number for the doctor's office as well during and at the end of the segment. Remember, any advice we give you today, you're certainly going to want to consult your own physician as well. You brought some before and after pictures. Let's go ahead and roll those because we got a lot of phone calls I want to get to too.
Sure.
The first one is...
So this is a breast lift. This is a woman before and about 3 months after a breast lift. And what you can see is that she has reshaping of the breast. The volume, surprisingly, is just about the same. And you can see there's scars. There's a scar around the areola, which is concealed. There's also a scar which goes down to the fold and a scar which is hidden in the breast fold. And I show these pictures to women that are interested in this surgery on purpose to show where the scars are. It's only 3 months, so they're going to be red, they're going to be raised. At a year, all of the scars will mature and they will become softer, flatter, whiter, but at 3 months you can really appreciate the result in the breast shape.
And I guess, you know, when you think breast lift, you think that maybe the cutting would be above, but none of that.
And so the scars will all be hidden in a triangle bikini top, is what I tell my patients.
Okay, all right, let's move on to the next picture.
So this is a breast reduction, and this shows a couple of things. This also shows a breast reduction, so she's been reduced in volume, but before surgery she also has a lot of asymmetry. One breast is significantly larger and longer than the other one. After any breast surgery, the goal is always symmetry. You can see the scars are exactly the same as for a breast lift, but in this case we've also treated some of the physical symptoms related to having extremely large breasts.
Okay, and you have one more before and after.
So this is a breast augmentation. This is a woman who's had 3 children. She's finished her breastfeeding. She's waited at least 6 months until after she's completed breastfeeding, and she's seeking to restore her volume, similar to how she was when she was breastfeeding.
Okay, and again, that's the most popular type of surgery by, what, about 6 to 1?
Well, you know, it really varies, but of the invasive surgical procedures, meaning as compared to Botox and fillers, it is the most common procedure.
Okay.
And the goal is always to have a nice, natural-looking result.
All right, Dr. Horton, let's take the call from Kathleen from Petaluma. Good morning, Kathleen. Oh, we lost Kathleen. Okay, let's move on to Kathy. Oh, Cheryl from San Jose. Good morning, Cheryl. Do you have a question for Dr. Horton?
Yes. My question is, being that I'm a large woman, I would like to know, I would like to have a breast lift done. Should I lose the weight first and then have the breast lift done?
That's a very good question. My answer to that is always, if you are at a stable weight, and if you're healthy, meaning if you have a healthy diet, you're having good nutrition, if you're exercising, and if your weight is at your particular set point, meaning you're going to be staying at that weight regardless of whether you like it or not, that's an appropriate time to do a breast lift. However, if you are significantly overweight, or if you have a realistic goal of losing 10 pounds, maybe even 20 pounds, then I say go for it. Give yourself about 3 to 6 months, and then see what you can do on your own. And once your weight has stabilized and you have a healthy diet, healthy exercise regime, then sure, we can talk about it then.
Okay, Cheryl, hopefully that answered your question. Let's move on to Kathy from San Jose. Good morning, Kathy. You have a quick question for the doctor?
Yeah, my question is I had breast implants, saline, put in about 16 years ago, and my concern is this something that does need to be removed? How long do they last? You know, should they be replaced? You know, is it something that can stay in, you know, forever? But they are the Mentor brand, so that's my question.
Okay, that's an excellent question. I get that question a lot. A breast implant is a medical device, and so it's not designed to last forever. In your lifetime, it probably will need to be changed. However, if there's a problem with an implant, and if it's a saline-filled implant, saline is essentially sterile salt water. It's the same salt water you put in your eyes if you have contact lenses, same salt water that goes in the intravenous. So it's permeable in the body, your body will absorb it. If there's ever a problem with a saline-filled implant, meaning a leak or a rupture, the body will essentially drink the fluid. So if your implants look good and feel good, then they're fine, and leave them alone.
All right. Great. Well, that takes us to our next break. So we're going to hold off on the other calls until we can give them a little bit more time to ask. And for more information about Dr. Horton, you can call 415-923-3067, or you can check her out on the web at womensplasticsurgery.com. And for the first 20 callers, you'll be able to receive a complimentary consultation. And when we come back on Body Beautiful, we'll continue our conversation with Dr. KRON Horton, who will tell us everything we need to know about breast reconstruction surgery. We'll be right back.